So this is a short video to show the way to fit an XcelTrax with air boot on a patient. The first thing we do is undo all of the straps and fold them back on themselves. Now you'll notice that this top one is velcroed all the way around the liner, so you'll need to peel that one all the way off. And this will allow the liner to come out completely. Next, open up the liner and have the patient place their foot inside the liner. Now you'll notice that the patient sits on the edge of a chair with their knee bent at 90 degrees and foot flat on the floor. That's the easiest position to have the patient, most comfortable for them and you. So wrap this top section over the foot, and we can even place one of these little pads in across the front of the ankle. When we go to finish fitting the boot, there'll be a strap that sits across here, so it's a nice way to tuck it in at this stage of fitting and make sure that there's not going to be any risk of skin being exposed to the Velcro strap. Pull the liner around, making sure that it's snug without being super tight. Next, help the patient just gently slide their foot down and into the back of the boot. Now you might need to just give the uprights a little bit of extra width to help the patient into the boot. Just use your finger around the back of their heel and make sure that their foot is all the way seated down to the bottom and back as far as it will go. The next thing we do is just line up where these uprights, the stirrups, sit relative to the leg. So what we're looking for is the stirrups to line up with the center of the knee. So when you're happy, the little tabs that say pull up, you pull them out probably more to the front, and then that velcros down. There's velcro in underneath these stirrups to hold it in place. The next step is to secure the boot with the velcro straps. So starting at the ankle and pulling nice and firm. Double check that the patient's heel is down at the back. In terms of tension on the straps, they should be snug. You don't want the patient moving around. At the same time, they shouldn't be so tight that they will cut off circulation. And the patient should be your guide in terms of whether or not they're comfortably appropriate. The final strap you'll do is the top one, which velcros all the way around and secures the boot in place. Again, pull that one nice and firm and lock it in place. When you're happy with how the boot's fitted, the last job to do is inflate it. So there's a big red pump that sits on the front of the boot. This boot specifically has some air cells which sit in the back of the liner. So as we inflate here, the patient will feel that the boot fills up down lower in and around the ankle. So the aim with this is to make the boot a little bit more stable, and it also helps with compression for a patient that might have a little bit of swelling. So in terms of pumping, I often get the patient to do it themselves. If they just slide their thumbs inside the liner and begin to pump gently on the pump until they're comfortable. The key goal here is that if it's higher of a higher inflation, it will be more secure, but if it's overinflated, that it can start to throb and become a bit uncomfortable. So that's something really that the patient can decide on what's appropriate. And then there's a little deflation pump right immediately next to it if it becomes uncomfortable during the day. Once we've done that, the boot is ready to go.